Hey everyone, Dr. Moshe here. A beautiful evening to you. Certainly it is a beautiful evening here in St. Louis. Wanted to go ahead and talk a little bit tonight about healing and some of the questions that may come about when a person hurts themselves, in day-to-day, just going about their business, and things happen. All right, things happen. You slip, you fall, you bang your head. Maybe you've even bruised yourself or cut yourself. So I'm going to talk for a little bit on how the body heals distinctively between, say, soft tissue versus some of the more complex systems in the body. Okay? First and foremost, I think we've all cut ourselves at some point. We're chopping carrots or opening up mail and we get a cut. Pretty standard thing to happen. Doesn't necessarily have to be that big of a deal. And we're not talking about a cut that you find yourself having to go to the hospital and even to the point of needing stitches. A basic cut cuts through superficial tissue and it can heal reasonably well if it's cared for, in a few days to a week. Okay, not that long of a time. Probably the biggest inconvenience, other than initially seeing blood and then feeling pain, because you probably wouldn't have noticed it until you see red, and then all of a sudden, click, I hurt myself, ow, that hurts, is the inconvenience of having to wear a Band-Aid. In my situation, because I work with people on a daily basis, hands-on, big inconvenience. So, it's one of those things that the body heals pretty good without much circumstance. Okay, maybe you'll have a little scar, but probably not. Okay, now we go a little bit further. You're playing your favorite game, sport, maybe you're running about, and you pull a muscle. Okay. And you really snag it well. You're jumping around and with a nasty cramp and a discomfort, and it can go on for maybe a little bit, for a matter of minutes. But if you've really pulled a muscle well, you got to know that for the better part of a few days, you're going to be moving differently, and the chances are you're going to pull a muscle in your leg for the pretty average person day to day, unless you're being incredibly active, lifting weights or doing something that involves the use of the upper torso, where you may pull a muscle in your arms. Now, I'm not going into the complications of, say, pulling a muscle in your neck or your low back, because that can be much more involved with some of the substructures there involving the spine. But basic muscle from general activity or sports activity, muscle heals quickly. Again, so a light cut, a muscle pull, muscle spasm, something along those lines. We're not going to be out of commission for very long, but it could annoy us for a little bit. Okay, now we go a little bit more complex, and you have bone. Okay, you slip, you fall, you break a bone. Now, personally, I'm thankful I've never broken a bone, but I've known a lot of people who have, and as such, I'm going to share, based on both what I know medically speaking, as well as first-hand knowledge from people second-hand knowledge from people I've spoken with. Firstly, bones heal pretty quick, on the average about 6 weeks, and we really encourage to not keep a cast on longer than needs to be, because you actually end up with more complications by keeping a part of the body immobile for too long, where muscle actually starts to break down, to atrophy, to waste, and you end up with a lot more complications. But again, big difference between a cut, a muscle pull, and breaking of the bone, but still 6 weeks, a month and a half's time, may seem like forever until the cast is removed. And especially, as I'm told, the itching is enough to drive any normal person a little bit insane. So I'll accept that that is the case. But a month and a half really is not an extraordinarily long period of time for healing. So let's hear it for the body's ability to heal itself with the right support in place and a good cast and a good doctor to help apply it and, of course, remove it. Okay, now, what happens when you are, say, walking down the street and you catch your foot in a slot on the sidewalk and twist an ankle? Okay? I understand. You're thinking, I've done that. Or you're walking down a flight of stairs and you stumble on one of your kids' toys. Or, maybe you get caught up on something that's in the carpet and you twist an ankle. Okay, it's a common thing, a sprain, strain type of injury. And the question really comes about as to whether or not you have only injured muscle with tendon, and the tendon connects the muscle to the bone, or perhaps it's gotten to be even more complex where you've gotten to the point that you not only injure the muscle and the tendon, but you've gone deeper to the bone-to-bone connection and damaged ligament tissue as well. So what I want you to understand in sharing this little piece of information with you is, if it's just tendon, okay, the pain will stop reasonably quick when the swelling goes down and you're able to move around, say 7 days, 10 days, and the foot feels stronger and you think, okay, I'm fit as a fiddle. Keep in mind, the tendons takes, on the average, several months to heal, depending on how involved the actual injury was to the muscle tendon system. Which means, more than likely, if it hasn't healed fully and you haven't been cautious over those first few months, it's very easy to repeat the injury and create a higher level of damage than the initial injury was. So again, you trip, you slip, you twist, it hurts, it heals. Remember that there are other components of the body that are healing that don't necessarily communicate pain. They're not necessarily going to let you know that it hurts until you actually re-injure it again. Again, the body's trying to protect you to the best of its ability, and we tend to push our bodies harder than they're really meant to. Lastly, if it's ligament. Ligament is, of course, just incredibly strong stuff. Again, we're talking bricks and mortar, like building of a home. This is your bone-to-bone connection. The ligament connects bone to bone and holds it strong so that when you damage muscle and you damage tendon and you overuse your body, these ligaments are trying to keep your main structure of bone, of your skeletal system, together. And if you've gone ahead and damaged it, again, pain will dissipate reasonably quick once swelling and the pressure systems are relieved, but ligaments take 6 months, 9 months, even a year to sometimes heal. So folks, maybe you damage this playing tennis, falling down a flight of stairs, or yours truly tripping on a sidewalk. It's just an invitation for these things to happen. Good thing I know what I know. Be careful. Give your body time to heal, even though you're feeling great and fine and you want to go out there and continue to do activity. Be smart. If you have a brace, use the brace to prevent further injury from happening while those deeper, more integral tissues are healing. Okay, wishing you all a great weekend wherever you are, and thank you very much for giving time to listen to another little thought on health and healing. And until next time.